So the key when your prostate cancer is progressing on hormone therapy, which is usually a PSA rise on hormone therapy, couple of things. When a man has a rising PSA, he should be measuring two things. He should be measuring both his PSA and his PSA doubling time. 1, 2, okay? First thing. Second, the key to finding the metastasis lies in the medical imaging itself. So the question becomes between the patient and the doctor, what type of imaging do we order and when do we order it? How high should my PSA be? That factors in with your Gleason score, your PSA doubling time, and maybe some other factors. And what imaging do we use? For example, the standard imaging has typically for years been bone scan, which is a technetium-99 bone scan, and a CT scan. So a CT scan, let me back up. Patients don't really realize this, but this is important. No medical imaging is perfect. None of them are 100% accurate. So what that gives a patient a question to ask is, to your doctor, how accurate is this imaging in what we're looking for? Now if you ask the question, you'll get the answer, because there's this reality that if you can figure out the right question, you get the right answer. If you can figure out a better question, you get a better answer. But now we have a new imaging called the Axeman PET scan, which is more sensitive and more specific than, especially for soft tissue, certainly than the CAT scan. So those are the kinds of questions that patients, I think, should be initiating with their doctor. It's okay to initiate the question.